Now, we always assume that if you compress a nerve that it's going to give you symptoms because it's not designed to be compressed. Well, this is where the misconception comes, and this also makes sense with regards to what's going on when we look at research findings on MRI studies, because you can see people who've got no symptoms, and yet when you scan them you see compression of nerve, disc prolapses onto nerves and all this, and some people have pain, some people don't. So the compression itself isn't necessarily all what it's cracked up to be. It doesn't necessarily mean you'll have symptoms. And it's funny, we've got this weird assumption that, if something's being compressed and we can see it being compressed, that it necessarily means bad. Now, I know it sounds a bit weird to think this, but if you think about it, if you bend your elbow, you're compressing structures. I'm not kind of saying how, and I bend my elbow all day. And there's lots of things in this manner that go on in the body. I mean, your cartilage, the meniscus in your knee is taking compressive loading all the time. Every intervertebral disc in your back is taking compression all of the time. And therefore, things are designed to be compressed. Now, obviously, it depends on the extensiveness of compression, but even that is not always completely correlated. What it comes down to is sensitivity. Basically, someone's recently come out with a phrase, and this phrase basically says, nerves and the nervous system are designed to be compressed. And the reason people have symptoms is not because of the compression itself, it's down to whether or not there is sensitization to them nerves for whatever reason. And it isn't because of the compression that they're necessarily sensitive. A bit like someone can have high levels of pain with the same level of arthritis to somebody else. These come down to multiple factors which affect pain threshold. So we know that threshold is changed by exercise or lack of, by diet, good or bad, affected by psychology, so stress, anxiety, depression affect pain and pain sensitivity. Lack of sleep affects pain sensitivity. There are many factors that influence pain sensitivity, and this is more why nerves can be compressed in some people and they cause pain, and they're compressed in other people and they don't cause pain. So really it's interesting to just think of this, because there was another video that I did earlier on the bursa in the shoulder, and in normal healthy swimmers they had thickened bursas but with no pain. And again, it's an adaptive process where the compression on that bursa is just creating a normal adaptive process and there's no symptoms from it, therefore it's fine and it's normal. And what's interesting is that you can do some studies on people, or there have been studies done on people more to the point, where they've looked at the scan when they're in symptoms, say a disc prolapse in the lower back pressing on the nerve root, and they're in pain, they have pins and needles and all that, and then they go back to them down the line when the symptoms have resolved, and they scan them and see the same amount of compression. So how has that happened? It's because the nerve has become less sensitized and therefore settled down. So it's not all about this. And this also makes it interesting when it comes to surgery, therefore. Taking compressions off nerves, if it was about the compression, would simply make it 100% effective when it comes to surgical elements, when it comes to these type of things. And the reality is, it isn't 100% by any stretch of the imagination. So this means that you can take the compression off, no symptom resolution, still having problems. So even that adds up to what we're talking about here anyway. But anyway, that's just an interesting little topic, an interesting little idea that's coming about, which is nerves can be compressed with no problems whatsoever. It's more about how sensitive the nerves are, not actually that they're compressed themselves, and they maybe are designed to be compressed. Anyway, that's it for this video, and I'll see you next time.